Thank you. Good afternoon. I'm going to be talking to you today about specific learning disabilities, mainly about specific learning disabilities and how they're diagnosed. It's probably one of the most controversial disorders, at least in the U.S., in terms of how we go about diagnosing the condition. The most popular way now in the States is to follow a method called a pattern of strengths and weaknesses method. So that's what I'm going to talk about. And then, time permitting, I will get into the identification of intellectual disability, and primarily talking about the global ability score and how you go about interpreting the global ability score, particularly on a Wechsler test. There's more than one option available, and depending on which one you choose, both scores are not going to be identical. So I think it's important to understand how we select global ability scores for making that determination. So I'll begin with a brief definition of specific learning disabilities. Then I'll talk about the pattern of strengths and weaknesses approach, which we call the PSW approach for short. There are a few methods in the States, a few PSW methods. My colleagues and I have developed one of those, and I'm going to briefly talk about that method. One thing that's very clear to us is that the identification of specific learning disability is a diagnosis that's based on clinical judgment. And there are many sources of information that are necessary in order to render a good diagnosis of disability. And so the more foundational sources of information you have, the better you are able to exercise and use your clinical judgment to make a well-informed decision about the diagnosis. So I'm going to be talking about those foundational sources of information. We have a software program called Cross-Battery Assessment Software System, or XBAS, and that, because of the nature of the analyses that we do with our test data, we use regression analysis and other types of analyses when we look at the pattern of strengths and weaknesses. So you need software to do that because the analysis of the data is too sophisticated to allow it to be done by hand. So we developed a software system that you enter your data into, and then the software runs the analysis to determine if the data that you collected across cognitive abilities, neuropsychological processes, academic skills, if those data support a pattern of strengths and weaknesses that's consistent with a specific learning disability. And then I'll speak briefly to intellectual disability with an emphasis on the total test score from an intelligence test. So let me begin with a definition. In the United States, that federal definition is a disorder in one or more of the basic psychological processes involved in understanding or using language, spoken or written, which manifests in an imperfect ability to think, listen, speak, read, write, spell, or do mathematical calculations. And the term dyslexia is often used interchangeably with a disability in reading. The World Health Organization also has a definition of learning disability. However, the definition is so broad that it almost encompasses very, very low ability and very, very low ability across the board in cognitive areas, academic areas, is not consistent with a specific learning disability. So when we talk about learning disability, our terminology includes the word specific. And a specific learning disability is different than generally low average ability. So generally low average ability for us is not a specific learning disability. So there is a segment of the population who is below average. And below average individuals below average in terms of their cognitive ability often perform consistently with their in academic areas. So that's more expected underachievement or expected low achievement. And expected low achievement is not a disability. The disability is the unexpected part. So unexpected underachievement is what we're capturing in our pattern of strengths and weaknesses. And I don't believe the World Health Organization's definition captures that uniqueness, if you will, that a specific learning disability is just that. It's specific. It affects performance in some cognitive processes, not all cognitive areas. And so there are very specific cognitive processes that are the presumed cause of the underlying specific academic deficits. And those processing deficits that are consistent with your specific academic skill deficits, those deficits exist within otherwise normal ability, otherwise average ability to think and reason. And so individuals with specific learning disabilities think and reason like typically achieving peers. But they struggle mightily in certain areas, and that's because of their very specific cognitive processing areas. So the hallmark of a specific learning disability is unexpected underachievement. And just about, well, almost all of our methods of SLD identification are designed to quantify or capture that concept of unexpected underachievement. So currently there are 3 methods that are used in the States. One is an ability achievement discrepancy method. That's looking at a full-scale IQ and an area of achievement and determining if that difference is not only statistically significant but also unusual in the general population. So that's the most common way of identifying specific learning disability, but it's really too simplistic because your ability achievement discrepancy method doesn't answer the question why. Why is the child struggling, right? So you typically have a cognitive score that's a lot higher than your academic score. And so just looking at that discrepancy doesn't answer the question why. Why is that individual struggling to acquire basic reading skills like typically achieving peers? So in order to answer the question why, the third method that we're talking about, this alternative research-based approach, the pattern of strengths and weaknesses, is designed to answer the question why, because it helps get at the very specific cognitive processes that are related to the academic skill areas. We also have something called response to intervention. Response to intervention is actually a model of prevention rather than a diagnostic model. And basically, our response to intervention method is designed to examine whether a child responds to scientifically based interventions that are delivered with integrity over a significant period of time. And those children who do not respond as expected are then considered to have a learning disability. But the problem with that model is that not all children who fail to respond because of a specific learning disability. You can fail to respond to scientifically based intervention for any number of reasons, only one of which is a specific learning disability. So that's why we are now pushing, and there's a trend in the States toward the PSW model, this pattern of strengths and weaknesses model, because it captures specific learning disability better than ability achievement discrepancy and better than the response to intervention approach. So this is the guidelines that our government gave us for identifying specific learning disability based on the PSW model. It's an evaluation that considers whether a student exhibits a pattern of strengths and weaknesses in performance or achievement or both relative to age, grade level standards, or intellectual development that is determined by the group. That is, in our schools, we have a multidisciplinary team, so determined by that team to be relevant to the diagnosis of SLD using appropriate instruments. This particular slide is basically just a warning about, PSW involves looking at score differences as well, but we don't want to strictly follow formulas to make a diagnosis. We have to use the formulas that analyze data to inform our decision, not make our decision for us, because specific learning disability requires that you look at multiple data sources gathered in many different ways, and based on what we know about the condition, that is the definition of specific learning disability, do all these data sources converge in a way that supports the diagnosis? And that requires a lot of information, and it requires clinical judgment. So there are formulas that you use to analyze data, but we can't over-rely on those formulas, because when we over-rely on formulas, we often make decisions that are false, like false positives, false negatives, when we over-rely on formulas. So that's why our clinical judgment should supersede formulas. So in order to interpret the output of an analysis of PSW, analysis of a child's pattern of strengths and weaknesses, it requires a lot of information. It requires an understanding of contemporary theory. It requires an understanding of the theoretical constructs that are measured by the tests that we use. It requires an understanding of the relationship between cognitive abilities and processes and specific academic skills. So how do the processes relate to those academic skills? It may require cross-battery assessment to assess all the areas that are necessary in an LD referral, a referral of suspected learning disability, or to follow up on some aberrant score performances or unusual score performances to test hypotheses about why we may have scores that deviate in ways that were unexpected. So cross-battery basically means you can't just use one single test. Oftentimes you need to use more than one test to gather enough information to make a well-informed decision. And it also requires an understanding of the SLD construct, the specific learning disability construct. So each one of these areas is a research-based area that we should have knowledge of in order to inform our decisions about specific learning disability. The purpose of cognitive assessment is to inform diagnosis and also to inform intervention. And more specifically, the purpose of cognitive assessment is to understand specific cognitive strengths and weaknesses and how they interact with the child's educational environment and impact the child's ability to access the curriculum. And the idea is, once we uncover cognitive weaknesses, right, we need to understand how they manifest for the child. So a child who has a working memory deficit, finding that on our cognitive tests really doesn't mean anything unless we can determine how it manifests for the child. Once we figure out how it's interfering with the child's ability to access instruction and the curriculum, then there are things that we can do to minimize the effects of those deficits so that the child has better access to and greater access to the curriculum and instruction. Okay, so I'm going to talk about each one of these foundational sources of information. Of course, I can't do it in any great detail. I only have an hour, so I'm going to go through it rather quickly and just touch upon each one and highlight each one. So in terms of contemporary theory, requires an understanding of contemporary theory. The theory that we use most often in the States is called CHC theory, the Cattell-Horn-Carroll theory of cognitive abilities and processes. And so the Cattell-Horn-Carroll theory, or CHC theory, is made up of 18 broad cognitive abilities and over 80 narrow abilities. So it's a largely psychometric theory, and there are about 7 of these broad cognitive abilities that we assess with our cognitive tests. And within those 7 areas, there are more specific narrow abilities, and those specific narrow abilities, many of them interfere with, if they're low, if the child has weaknesses or deficits in these narrow abilities, some of these narrow abilities are very important for basic skill development. So if they're impaired, the child will struggle. And if they're impaired to the point where they're not easily remediated, then that's when you're talking more about a specific learning disability. Okay, it also requires, again, interpretation of the pattern of strengths and weaknesses, requires an understanding of the theoretical constructs that are measured by our cognitive tests. So I'm not sure which version of the WISC you may be using, probably the 3rd edition. I'll speed it up here. So we're on edition 5, but many of the subtests you should recognize. But believe it or not, our verbal areas down to 2 main subtests, similarities and vocabulary. So information and comprehension is still on the test, but the core battery requires 2 subtests for crystallized intelligence or verbal ability. So we're down to a word knowledge composite. We have a VCI, Visual Spatial Index. Visual Spatial Index primarily measures visualization. Visualization is a narrow visual processing ability. The Fluid Reasoning Index is based on a test of inductive reasoning, which is matrix reasoning, a test of general sequential reasoning or deductive reasoning, and that test is called figure weights. It's a very good index of fluid reasoning. A working memory index, which measures short-term memory, both memory span and working memory. And then a processing speed index, which measures narrow processing speed abilities. So again, knowing what our tests measure from a theoretical model is important, because the manifest cognitive abilities have important relationships to the academic skill areas. So that's what we're going to talk about next. What's the empirical relationships between our cognitive processes and specific academic skills? Now, there's a series of tables in here for you to read through and get a sense of these relationships. So down the left-hand column, these are the codes for each of the abilities in CHC theory. So you have fluid, crystallized, short-term memory, visual processing, auditory processing. Then in this column, you have narrow abilities within these broad domains that have been found to be most closely associated in this slide in reading. So this is about reading, the relationships between cognitive abilities and reading achievement. And the etiology of reading functions is here. Okay, so we have a neurobiological basis for learning disabilities, and that's what this column is about, the etiology. This is an extension of the reading slide. We have one here for math. So this one's related to what are the cognitive processes related to math achievement, and then one for writing achievement. And these should be used as a guide to understanding whether or not a child has some cognitive processing weaknesses in any areas that are most closely related to, empirically related to specific academic skills. Okay, so now I want to move into the main areas in CHC theory and how they're, to summarize for you briefly, how they're related to specific academic skills. So when we have a referral in the States for suspected learning disability, we want to assess performance across, at a minimum, these 7 areas. We want to assess fluid reasoning, crystallized knowledge, long-term storage and retrieval, working memory, visual processing, auditory processing, and processing speed. So at a minimum, we want to assess narrow abilities within each of those broad domains because we know that there are established relationships between them and specific academic skills and how academic skills develop. There's evidence for these relationships, and also, once we understand how these processes manifest for the child, it does 2 things. It brings ecological validity to our test findings, and it gives us a target for intervention. And those are 2 very important things. So it doesn't make sense to give cognitive tests unless you can understand and try to at least figure out how those deficits manifest. Once you understand manifestations, it brings ecological validity to your test findings, and it gives you a target for intervention. And that's why we do assessment. That's really the main purpose. So fluid reasoning, and what is fluid reasoning? Anytime we're faced with a problem that we cannot solve automatically, we're measuring novel problem solving, and that's really the essence of what fluid reasoning is. Forming and recognizing concepts, identifying and perceiving relationships, things of that nature. And how does it relate to reading? Well, interestingly, fluid reasoning is not related to the development of basic skills, basic academic skills. When the curriculum shifts from learning to read to reading to learn, that's where fluid reasoning comes in. That's where you're going to begin to see that relationship, because once that curriculum shifts from learning to read to reading to learn, now you're into comprehension, reading comprehension. Reading comprehension requires drawing inferences from text, making predictions, comparing and contrasting. And that's where you're going to see GF come in, fluid reasoning come in. Also important are executive functions like planning, organization, self-monitoring. Those are also very important for reading comprehension. Fluid reasoning is also related to math and writing achievement, so it's related to higher level math and it's math problem solving. It's also related to higher level writing like essay writing, persuasive writing. Now, these charts, and I'm going to now start flipping through the charts more quickly, but there's a chart like this for each of those 7 areas that I said were important for LD identification. And so the purpose of these charts is to say, okay, if you're measuring fluid reasoning, what's the definition of fluid reasoning? So if you're measuring it, you need to know what it is. And then, how does fluid reasoning, a deficit in fluid reasoning, how does it manifest in general? And then how does it manifest more specifically in reading, in math, in written language? And so these tables and the information in these tables are designed to get you to start thinking about, if I uncover a deficit in this area, what should I be looking for in terms of how that might manifest for a child in a classroom? And a teacher can work with you in trying to understand those manifestations. You should have received a link to my slides, and there's actually a link to a folder, and in that folder there's these tables have been turned into forms. So it's a form that you could use as you're interviewing a teacher or a parent, or it's a form that a teacher can actually fill out. So it may be useful in that regard. Okay, crystallized intelligence. This is information that has built up over time, beginning in infancy. It's all about language exposure, word usage, knowledge of language. And if you have good crystallized knowledge, then you use language well. You have good listening abilities, good ability to communicate. And GC is probably the single most important predictor of overall academic success. So of all the abilities we're talking about today, GC is probably the most important, that language, the knowledge base. It's like your own personal library of everything you know. And crystallized intelligence is related to reading achievement. It has a strong relationship to reading achievement. And those abilities, all those narrow GC abilities, become increasingly important with age. There's also a relationship between GC and math achievement, only it's not as strong as the relationship between GC and reading and writing. There's where the strongest relationship is. Here's your manifestation table, general and specific manifestations for a GC weakness. Auditory processing has to do with the ability to perceive, analyze, and synthesize auditory information like sounds. Phonetic coding is a narrow GA ability. It's often referred to as phonological processing, sound-symbol correspondences. And phonological processing is important at the early elementary school years because that's when we're learning how to read. Phonological memory has also been found to be important in understanding and learning how to read. Manifestations table for GA weaknesses. Short-term memory, the ability to hold information in one's mind and then use that information within a few seconds. So there's memory span, which is temporal sequencing of information, and there's also working memory, which is transforming information in some way before output. Now, individuals with short-term memory difficulties may have a hard time following directions, understanding long reading passages, spelling, sounding out words, things of that nature. And we often provide children with memory problems with ways to compensate for their memory deficits. Working memory in particular is critical for learning and academic success in school. In fact, it's one of those areas that we refer to as a domain general ability. It affects performance in reading, in math, in written language. And as you get into a more advanced curriculum, then your demands on working memory become more and more. And so individuals with working memory deficits are going to struggle in the learning process in general and are going to need to be provided with good compensatory strategies to help minimize the effects of their memory problems. Here's a manifestation table for short-term memory. Long-term storage and retrieval is an individual's ability to take in and store information and then retrieve that information at a later time, quickly retrieve that information, usually through association. Now, I know the WISC-3 does not measure GLR. The WISC-4 did not measure GLR. The WISC-5 measures GLR. The WISC-5 measures GLR because of how important it is and all the research that has come out about the importance of GLR for learning and for reading achievement. And really, a part of GLR is also important for automaticity. The basic skills, we're expected to be automatic in the basic skills by the end of 3rd grade. And so part of the GLR is related to that automaticity, the development of basic skills. We can think of long-term storage and retrieval as a filing cabinet. Like use a filing cabinet example. So this filing cabinet you can see is pretty messy, right? But then you have a filing cabinet that's really very well organized. And so some people maintain information like this. You know who you are, right? Some people have filing cabinets that look like this, right? So if I was to tell you to find some, let's assume that both filing cabinets have the same information in them. If I send you to the filing cabinet on the left and ask you to find a very specific document, it would probably take you much longer to find it here than if I sent you here, right? And so this is how we organize information. Some people organize information very nicely. They encode information in ways that allow them to retrieve it very easily at a later time. Whereas other people, it's in there somewhere, but they have a hard time retrieving it because it wasn't encoded well. And so if we understand this about how individuals encode information, and if they have poor encoding strategies, then we can help them move from this to this through really good techniques for teaching children how to learn. So that's why it's so important to assess GLR. GLR is not what is stored. What is stored is GC. GLR is the process of getting the information in there and then retrieving it at a later time. The tip of the tongue phenomenon, if you're familiar with that, you know the name of something, but you just can't retrieve it. You know, it may pop into your mind, 2 hours later, right? That's individuals with GLR problems experience that all the time. They have a hard time pulling out information, so they often talk around words rather than give you a very specific word, because they're having a hard time retrieving it. So we see some of that. GLR is divided really into two sections. There's the learning efficiency part of GLR, which is things like associative memory and meaningful memory. And then there's the retrieval fluency part, how quickly we can retrieve information from our lexicons. Ideational fluency, name as many animals as you can as quickly as you can. Word fluency, tell me all the words you can think of that begin with a particular sound. Naming facility, rapidly name pictures, rapidly name letters, rapidly name numbers, right? That, in particular, this rapid naming, that's related to reading. The research shows that that kind of task, see something, say it, say what it is, see it, say it, see it, say it. That duration of time between see it and say it is longer in individuals with dyslexia. So that's why that's a very sensitive test, sensitive diagnostic test for specific reading disability, and it's on the WISC-5 now. It's a test that it's alternating between letters and numbers. And so rapidly alternating between letters and numbers, it's sensitive to dyslexia in particular. So naming facility or rapid naming, important during the early elementary school years. Associative memory is also important, and it's important for developing basic skills across the board. Here's your manifestations table for GLR. If you look at the types of memory that are important to assess for suspected learning disability, memory span, working memory capacity, learning efficiency, retrieval fluency, these are the WISC-5 tests that measure those areas, and you can see that the WISC-5 now expanded to include all of these areas of memory. Visual processing, this is our ability to think about visual information. What would this shape look like if I turned it upside down? Or if I folded this up into a cube, which one would it be? So those are like block design, visual processing tasks. Well, visual processing tasks, things like putting puzzles together, completing mazes, those types of things are related to higher level math, right? They're not really related to reading achievement. So you're on version WISC 3, which has a lot of visual processing to it. But it's not the visual processing that's related to reading. Reading is the most common referral in the schools, at least in the US. Anytime a child's referred for suspected learning disability, the area is, 80% of the time, the area is for reading. And so when we give all these visual processing tests, they're not the visual processing tests related to reading, they're related to higher level math. Geometry, trigonometry, that sort of thing. Processing of abstract stimuli occurs in a different part of the brain than processing of letters and words. And that's why that visual processing, as we measure it on the Wechsler, is not related to reading. What's related to reading visually is orthography or orthographic processing. That's the system of marks that make up a language. Upper and lower case letters, punctuation marks, things like that. That's orthography. That's the part of visual processing that is related to reading. And individuals with orthographic processing problems don't automatically recognize words. It's very hard for them to develop a sight word vocabulary. Very difficult, because they're not automatically recognizing words. They have they struggle with that. So they tend to be sound by sound readers. They want to try to decode words. They may see a word in a paragraph, sound it out, right? See it again 2 sentences later and forget it. So they sound it out again. And then they see it again 2 or 3 sentences later and they sound it out again. They need multiple exposures in order for them to develop a sight word vocabulary. So whenever you're assessing visual processing related to reading, the visual stimuli must include orthographic units, letters and numbers, not pictures and abstract designs. So for visual processing, visualization is related to math problem solving, whereas orthographic processing is related to basic reading skills and spelling. And there's your manifestations table. And then finally, there's processing speed. Processing speed is how quickly we can do simple clerical type tasks. It usually requires sustained, focused attention. You're familiar with coding, subtests, symbol search subtests. That's what we're talking about here with processing speed. Processing speed is important during the early elementary school years. That's because that's when we're developing basic skills and we're working toward being automatic in those basic skills, which is where processing speed comes in. Okay, and your manifestations tables. All right, so very quickly we talked about 7 broad cognitive abilities and some of the narrow abilities within those broad domains. They all have important relations to academic achievement. They all manifest in real-world performances in the classroom and otherwise. Those manifestations provide us ecological validity for our test findings, and they allow us to identify targets for intervention. Once we target a manifestation for intervention, then there are things that we can do to minimize or bypass the effects of that deficit on the individual's ability to access instruction and the curriculum. And if we think about this slide, we'll look at it from the bottom up. And so let's suppose we did an evaluation of reading, we assessed all of these areas. When we identify deficits in phonological processing and orthographic processing, we should be doing that very early, age 4, age 5, age 6, really no later than age 7. We should be assessing orthographic and phonological processing. And if we identify deficits in orthographic or phonological processing, we want to train the processing deficit to the point where it becomes skill. We know that we can do that through good interventions. There's a lot of fMRI research now showing that individuals actually following interventions where they improve in these skills, they demonstrate normalization of brain function following good interventions. So we know that we can change processing deficits to the point where they become skill. We have the most information on that and the most research on that in the area of phonological processing. We are just beginning to now see the research on orthographic processing. So that's the point there. If we start to uncover areas of weakness in memory abilities, working memory, long-term storage and retrieval, those kinds of deficits are going to obstruct learning. They get in the way, but there are things that we can do to minimize their effects. Once then we get into identifying a deficit in crystallized knowledge or fluid reasoning, now you're getting to a point where these are broader, more overarching kinds of abilities. And so when they're weak or deficient, they place upper limits on learning and production. So what you're likely to see is a slower rate of learning and a lower level of learning. So these children learn more slowly, and where they achieve is not as high as typically developing peers, right? Because fluid reasoning and crystallized knowledge place upper limits on learning and production. It doesn't mean these children can't learn. They absolutely can learn, but they're going to learn at a slower rate, and how much knowledge and how much higher level kinds of tasks they can do and accomplish is going to be lower than that of more average or above average children in GF and GC. May require cross-battery assessment. Basically, cross-battery assessment, you have two tests that measure the same ability. One test is average, another test is deficient. Well, we don't know that a low picture recognition test, which is a visual memory test, we can't say based on a single subtest that this individual has a deficit in visual memory, because we really don't know that. That's only one score, and it's a subtest score. It's the least reliable on the battery. So we want to do a little bit more investigating there. I need to find another test of visual memory because I want to test this. Does the child really have a deficit in visual memory? So I need to find another visual memory test. This is just a list of tests that we have, batteries that have subtests that measure visual memory. So I say, oh, guess what? I have access to the TOML, so now here's my 3 subtests that are visual memory tests. And now I can follow up with another visual memory test and test that hypothesis. Does this child really have deficient performance in visual memory, or was that some kind of spurious finding, right? So that's just very briefly one aspect of cross-battery assessment that's often used. And then requires an understanding of the SLD construct, what SLD is and what it is not. We started talking about how you identify specific learning disability following a pattern of strengths and weaknesses before our federal regulations even came up with it as an alternative for methodology. So we started talking about it in the early 2000s, and we wrote about it many times in several different books, and then we finally gave it a name. We call it the dual discrepancy consistency model. These next 2 slides describe that model. So it talks about what SLD is and what it is not. And so that's this column here. And then what's the focus of the evaluation? What are some examples and methods and data sources that you can use? And then what are some criteria for determining if that particular aspect of SLD is present or not present? This is probably the most critical. Level 4 is the most critical in terms of understanding what SLD is according to this PSW model. And I'll just read that for you. It says, the specific learning disability is a discrete condition differentiated from generalized learning failure by generally average or better ability to think and reason, and a learning skill profile exhibiting significant variability indicating processing areas of strength and weakness. That definition is what is meant by a pattern of strengths and weaknesses. And because of the type of analyses that we do with our data, it requires our program in order to understand if those relationships are consistent with the pattern. And so now let me move in and talk about that pattern. So when we talk about pattern of strengths and weaknesses, the key features are basically there needs to be evidence that there's some kind of cognitive impairment, some low cognitive functioning in specific cognitive processing areas. There also needs to be evidence that there is low achievement, because we know that learning disabilities first manifest as difficulty acquiring basic skills. There also needs to be evidence of cognitive strengths, intact abilities. And there needs to be a consistency between your cognitive areas of weakness and your academic areas of weakness, right? So that's the empirical research that we just talked about, that our research shows that there is a consistent positive relationship between very specific cognitive abilities and processes and specific academic skills. And then there need to be discrepancies between your cognitive strengths and your cognitive weaknesses, your cognitive strengths and your academic weaknesses. These discrepancies are necessary basically to say, yes, these differences are real, they're not due to chance. These are reliable differences. And then to take it a step further and use base rate data to show that these differences are indeed unusual in the general population. We're talking about a disability. Disability is unusual. In our schools, 4 to 5% of our school-age population have been identified with specific learning disabilities. So it's not 20 to 25%, it's not 30%, right? It's low. And so base rate data are important to make that determination. So if we were to look at the pattern, this is just some data from different batteries. Here's reading areas, here's some processing areas related to reading, here's some of the other broad cognitive abilities we talked about, long-term memory, short-term memory, fluid, visual, crystallized. And so give a battery a test and take a look at where those tests fall. These first set of tests are on reading and some of the processing areas related to reading, like phonological processing and naming facility, for example. And then we have areas in GLR and GSM and GF and GV and GC, which are all kind of falling within normal limits here, where these are below, fall outside of below normal limits. And so the areas that fall outside and below normal limits, that's like your two bottom ovals. You have your cognitive weaknesses in phonological processing and naming facility, and you have your academic weaknesses in basic reading skills. So that's a pattern of empirically or logically related cognitive and academic deficits. That's what we call a below average aptitude achievement consistency. That's the consistency between the two bottom ovals. And that exists within a generally average ability profile, at least average ability to think and reason. And it's also consistent historically with this concept of intra-individual differences. But it's not just any intra-individual differences, right? So if you looked at this pattern and you moved everything to the right, so push all those scores all the way over to the right, where the lowest scores are within normal limits and the higher scores now are well above normal limits. Well, you still have all your discrepancies there, but those are not discrepancies that are consistent with specific learning disability, right? Because everything is at least average or better. Average ability is not a disability. If average ability was a disability, we'd all be disabled, right? Okay. So the software that we have does the dual discrepancy consistency. It looks at the academic weakness, it looks at exclusionary factors, which I'll talk about in a minute, looks at the cognitive weaknesses, and then it looks at two discrepancies and the consistency. And it uses all of your data, all of your cognitive data, all of your achievement data, all your special purpose tests, neuropsych tests, memory batteries, and it analyzes it all together to determine if there's a dual discrepancy consistency pattern that supports the SLD construct. Another thing that I want to say, just to be clear about those two bottom ovals, is that this is considered to be a causal relationship. In other words, cognitive processing deficits cause academic skill deficits. But the causal relationship is not deterministic. The causal relationship is probabilistic. So what that means is, just because you have a cognitive processing weakness doesn't mean that you're going to have an academic skill weakness. We have children walking around our schools all over the world with cognitive processing weaknesses and no academic skill weaknesses because they've managed, because they have good cognitive capabilities in other areas, they've managed to compensate for processing weaknesses so that they can perform okay academically. So what happens is that cognitive processing weaknesses raise the risk of academic skill weaknesses, but do not guarantee them. Cognitive processing weaknesses raise the risk of academic skill weaknesses, but do not guarantee them. And the opposite too. Just because you have academic skill weaknesses doesn't mean that you have corresponding cognitive processing weaknesses. You can have academic weaknesses for any number of reasons, only one of which is a cognitive processing problem. So you have to think about that relationship as a probabilistic one. The more processing areas that you have that are weak, and depending on which areas they are, the greater the likelihood is that you'll have an academic weakness. There are different reading disability subtypes that have pretty consistent findings in the literature. One, the terminology really doesn't matter. We call these conditions different things depending on what researchers are using the terminology. But dysphonetic dyslexia, basically difficulty sounding out words in a phonological manner. Surface dyslexia is difficulty with the rapid and automatic recognition of words in print. That's the orthographic processing deficit. Mixed dyslexia is a combination of phonological processing and orthographic processing. This is the type of reading disability that is most difficult to treat. And most individuals who really struggle with learning how to read most likely have difficulties in both phonological and orthographic processing. It's just that our tests have not been, until just very recently, have not been sophisticated enough, and the research hasn't really made its way into our profession enough to have lots of tests of orthographic processing. We just started to develop tests of orthographic processing. We just started kind of pushing those tests into the schools, and now we're discovering that more and more children are presenting with orthographic processing deficits, right? So it's important to understand if they have phonological and orthographic processing, because the interventions will be different depending on what the underlying cognitive processes are that is causing difficulty acquiring reading. There's also a type of disability related to reading, but it's related to reading comprehension deficits, even though the mechanics of reading are fine. So you can read, and probably read well, but you have a lot of difficulty acquiring meaning from text. And so these next two slides show the different subtypes of reading disability, the brain relationships, a much better description of the disorder, some measures that can be used to help identify whether or not that subtype exists, what the CHC and neuropsych processes involved in those subtypes are, and that the treatment changes based on what subtype you're talking about. So intervention informs, right? So So you need to understand what subtype it is. Really drill down. What's the underlying cause of the reading problem? You understand the underlying cause, and that drives what the intervention will be. Not all definitions of specific learning disability assume at least average overall ability to think and reason. For example, in our definition, we say you need to have otherwise average ability to think and reason. And this dates back to the early 1900s, right? So in the States, our definition of specific learning disability really hasn't changed in 100 years. What keeps changing is the methodology. Why the methodology keeps changing is because in our schools, general education has a hard time helping all children with learning needs. So our definition of specific learning disability, even though it hasn't changed, the methods are changing to get more and more kids services in special education services. So it's kind of a problem in the States, but historically, all definitions of specific learning disability assumed that you had at least average ability to think and reason. The children often have average and above intelligence and good memory in other respects. That's Hinchelwood, 1902. Many of these children have a high degree of intelligence. That's Samuel Orton, 1937. It seems probably that psychometric tests as ordinarily employed give an entirely erroneous and unfair estimate of the intellectual capacity of these children. That's Orton, 1925. And on it goes. Generalized integrity and deficiency in learning, there is a deficit in learning in the presence of basic integrity. The clearest expression of special disability is low scores in a series of tests conjoined with average or superior scores on tests in other areas. That's said in 1935, and that's what we're doing now, right? So the definition is not changing. People keep trying to change the methodology because so many children need help. And we only have one category for a child who needs help in learning, and that category is specific learning disability. Right? So we have specific learning disability, we have intellectual disability, but we don't have anything in between that. And there are children in between specific learning disability and intellectual disability, and those children are struggling academically. But they don't have unexpected underachievement, they have expected underachievement because they're generally low average in their GC and their GF. We used to call those children slow learners. And it was actually an okay label because it described them well. But it fell out of use because it has a negative connotation, right? A slow learner, that's a negative connotation. But the reality is that children who fall in between SLD and ID have a slower rate of learning, and their overall achievement is lower than typical. That's what we refer to as general learning difficulty. But we don't have a category for specialized services for general learning difficulty, and they struggle in general education because of that. So we try, in the schools, we try to put children with general learning difficulties in special education under the umbrella of specific learning disability. And if you follow this model, those children are sometimes left out because they don't meet this criterion of at least average ability to think and reason. So I think that's an important distinction. And so if we follow the definition historically, the last 100 years of what has been said about specific learning disability, this is the definition. We choose, some places choose to use it, but the places who choose to use it have a lot of resources in general education to help children who are between specific learning disability and intellectual disability. Okay. All historical approaches to SLD emphasize the spared or intact abilities that stand in stark contrast to the deficient abilities. Even Canada's an entire country, this is their definition, demonstrate at least average abilities essential for thinking and reasoning. So you have your specific cognitive processing areas, but you also have the intact ability to think and reason. That's the definition, that's the more traditional definition, historical definition of specific learning disabilities. We keep changing the methods because we're trying to help as many children as possible. Okay, so identification of specific learning disability involves more than examining scores on standardized tests. It's a convergence of data sources. Multiple data sources need to be considered. Also, what's very critical for SLD identification are the exclusionary factors. We look at all of these factors and we have to decide, are any of them the primary cause of the learning problems, or do they contribute to the learning problem? So for example, visual difficulties, hearing difficulties, motor difficulties, below average general cognitive ability or below average adaptive functioning, social, emotional, psychological factors, environmental factors. Any one of these, if we identify any one of these as the primary cause of the learning difficulties, then that rules out specific learning disability, and we focus on the primary cause. Some of these can contribute to the learning problem, but only when they're the primary cause do we rule out specific learning disability. So this is another area that is really important in making the diagnosis of specific learning disability. These rule-outs are really critical for the diagnosis. In your handouts, we have an exclusionary factors form, so you can see all of, each one of these areas, there's a lot of subcategories, so you can see the details about the exclusionary factors. So you have, these are the handouts. You have the definitions, they give you definitions of all the abilities. I've given you the tables on the specific manifestations, and I've given you the exclusionary factors form when you go to that link. And then finally, intellectual disability, and I know I'm actually out of time, so let me just I'm going to jump ahead a few slides and just give you some understanding of why I think it's important to look at which global ability score. You know that intellectual disability, we'll talk about IQ that is approximately 70 or below, right? So that's usually the cutoff for intellectual disability. With that cutoff, not on the WISC-3, but on the WISC-4, there's a score called the General Ability Index. On the WISC-5, you have a General Ability Index. Here's what the full-scale IQ looks like on the WISC-5. 2 tests of GC, a GV test, 2 tests of GF, a GSM test, and a GS test. So we have 7 tests now to make up the full-scale IQ on the WISC-5. Now these two tests have lower G loadings. A processing speed test has a pretty low G loading, right? Which means it's not about higher level thinking and reasoning. So it has a low G loading. Memory tests, particular memory span tests, tend to have moderate and sometimes low G loadings, right? So they're part of the full-scale IQ. The lower functioning individuals score higher on processing speed and memory than they do on visual processing, crystallized intelligence, and fluid reasoning. So because they score higher on processing speed and memory as compared to the other abilities, their full-scale IQ may be a little higher than a full-scale IQ made up of only tests that have high G loadings, okay? So this is the alternative to the full-scale IQ on on the Wechsler. The alternative is the General Ability Index, GC, GV, GF. 0 of these tests have low G loadings. All of them have high G loadings. So when we talk about higher level thinking and reasoning, that's better captured by a full-scale IQ as, better captured by a General Ability Index as compared to the full-scale IQ. Full-scale IQ has low G loadings. GAI, General Ability Index, all high G loading. So if you're talking about intellectual disability, this is the index that's going to capture higher level thinking and reasoning. So if this index is about 70 or lower, then you're in the ballpark in terms of intellectual disability. The full-scale IQ, because it has the lower G-loaded test, may bump that up a little bit. So when you're right around 70, you're right in that area, you're going to have to make a distinction between your full-scale IQ and your General Ability Index. And if we're talking about intellectual disability, you really want to look at this score, because this score is about higher level thinking and reasoning. And probably we'll do a better job of determining that. And I've given you some information about this that comes right out of the manual. And if you look at, here's the ability range is 79 and lower. And it shows your processing speed is higher than your full-scale IQ, up to 24 points higher, and that's typical. The lower functioning you are, the higher your processing speed as compared to your general ability. Processing speed versus crystallized intelligence. In your low ability area, up to 24 points higher. Processing speed up to 24 points higher than your verbal, that's typical. Processing speed versus fluid reasoning, up to 24 points higher than your fluid reasoning, that's typical. Memory areas, up to 19 points higher than your fluid reasoning, than your crystallized intelligence. So you should expect GS and GSM to be higher than your ability, your general ability to think and reason. Look at this. When you're in the 120s and higher, up to 4 points between your working memory is higher than your full-scale IQ, only up to 4 points is common. As soon as you hit 5 points, that's uncommon in your high-functioning people. But you have to hit 25 points to be considered uncommon in your low-functioning individuals. So what I'm trying to say is, then I'm out of time. What I'm trying to say is that the lower functioning you are, you see those low G-loaded tests higher than your high G-loaded tests. That's to be expected. You shouldn't expect to see anything else. But that also goes to show that your GAI is your better index than your full-scale IQ. Okay, so I'm going to, since I'm out of time, the last tables I wanted to tell you about are differential diagnostic tables. So you have intellectual disability here, you have specific learning disability here, and then you have general learning difficulty here. So these are 3 different categories, all affecting learning, and they all have different criteria for identifying them. So cognitive ability and adaptive behavior are different in these different groups. The etiology is different in the different groups. And response to instruction and intervention program are different in these different groups. So this table, just generally speaking, can help differentially diagnose those 3 groups. So identification of specific learning disability, it requires a convergence of data sources. Data should be gathered through multiple methods using different instruments, and exclusionary factors must be considered. Identification of intellectual disability. We need to consider what global ability score you're using and what it's made up of. If you're trying to determine intellectual disability, you should be using tests where their loadings, the G loadings, are the highest, not mixed with low G loading tests, more pure high G loading tests. Okay, that's all I have for you today. I will be up here if you have any questions. I'd be happy to answer them for you. Thank you very much.
Questions?